I'm very happy to be a part of this program to honor and salute our patients of courage. And for this particular super specialty, which is aesthetic and reconstructive surgery, I think this program assumes more importance because this specialty, in a way, is the most visible face of science and medicine and is perhaps the best example of a gift from the world of science and medicine to society. So if you take a look at a trauma case, it offers the opportunity for patients to be restored to their normal, natural living, to their functional life, to pursue livelihood and so on and so forth. If you look at it from the point of view of cleft and palate surgery that we have done a lot in association with Max India Foundation and the SOS Children's Village, it gives that new appearance a completely new lease of life for those, may I say, unfortunate victims or deprived ones. And for those who opt for any cosmetic reconstructive surgery in a world where, in a modern society where appearances and looks do matter in the time in which we live, this is another way of a God-given gift for those people. Dr. Sunil Chowdhury's capabilities are just outstanding and stupendous. I think he also has a God-given gift to excel in this particular area, and I'm glad this program is working and that we have the opportunity to honor our patients of courage today.
In his mid-40s, Dr. Nitin Pandey is a successful pediatrician in Dehradun, where he lives with his wonderful wife Sonia. Nothing in their simple lifestyle could have prepared them for the huge shock they got when the persisting problem in Dr. Pandey's mouth was finally diagnosed as a tumor, a cancerous growth on his tongue.
Just then all hell broke loose. Didn't know what to do. Panic. या क्या करें? मतलब कुछ समझ में नहीं आया. His cousin, who's his professor at AIIMS, who has a really good knowledge of all the doctors everywhere. So he had shortlisted 3 doctors for us. Dr. Vedant and Dr. Chaudhary was one team. And he talked of 2 other doctors also. He had said that since the growth or the tumors was very huge, he would definitely require plastic surgery. So we have to go to a place where there's a very good plastic surgeon. And his friend had highly recommended this team of Dr. Vedant and Dr. Chaudhary at Max.
Dr. Pandey's case is unique in few aspects. For example, he's young. He does not have the usual risk factors of misuse of tobacco and alcohol that we look in almost 90% of our patients with oral cancer. During my interaction with Dr. Pandey, I found him to be quite positive in his attitude towards the disease and the further treatment approach. This is a 45-year-old practicing doctor from Dehradun. He presented with a non-healing ulcer on the left side of the tongue, which was biopsied at Dehradun and turned out to be squamous cell carcinoma. As you can see in this photograph, this is an ulcero-infiltrative lesion on the left lateral border of the tongue.
Till late 80s, the judgment was to a great extent on clinical evaluation and added by at best CT scan. Now we at times in the same patient do CT scan, MRI and PET if required to get a better understanding of what is the extent of problem, plan the surgical resection on a model so that we are able to discuss with our colleagues in a much better way what is the extent of resection, how do we plan to reconstruct, all these things. Now the best way to put everybody's mind together is to have something like a tumor board, where we have a multidisciplinary approach. Everybody puts his ideas on the given patient, we discuss the situation, we thrash out the ideas and then we come to a single plan.
The surgery was performed and it carried on for the whole day. It started at 7 in the morning, it carried on till 5 in the evening. Both the things had to be done simultaneously. The removal of the tumor plus the plastic surgery.
In Nitin Pandey's case, the surgery lasted nearly 12 hours. It went flawlessly. We shifted him to the surgical ICU after the surgery was over. And next day we brought him out of anesthesia and sedation very gradually, and he did marvelously well.
We usually associate tongue with speech and swallowing.
But then if tongue was not there, one's airway would also not be protected from liquids and food, and one could even choke to death. So herein lies the challenge. We have to make a nice and soft, pliable tongue which moves, gives him good speech, and at the same time allows him to swallow nicely, eat food, and also protect his airway. Now, where would we find such a soft and nimble tissue? The answer lies in the skin of the forearm. This skin is extremely thin, it's pliable, but if one had to transport this skin to the area of the tongue, one would actually require microsurgery.
Dr. Chaudhary, he explained to him what they would do, so how the procedure would be carried out, how they would take out skin from this part of his hand and reconstruct the tongue.
Dr. Chaudhary did explain to me in a very nice and a jovial way that he was going to take skin from here and put it here, and he was going to take from my thigh and put it on my arm. It seemed such a small and a very light-hearted thing that I never realized the implication of it.
Microsurgery could facilitate transfer of tissues from one part of the body to another. Crafting the forearm skin into a tongue was actually the easy bit. The most complex bit was to bring back the blood supply into this forearm skin to make it a live tongue. This would basically mean that we had to join the blood vessels of the forearm skin, which were less than 1 millimeter in size, to the blood vessels in the neck and restore the circulation back again. And that too had to be done within the first 3 to 4 hours after it had been detached from the forearm. Imagine a 1 millimeter size blood vessels being joined together. You would need a stitch which was finer than a human hair, and that's also being done with hands. We have the best microscope in the world which can magnify things up to 20 times, but the fact remains that we still have to do the joining of the blood vessels with bare hands.
This is a real test of the surgeon's skill and dexterity.
One of the reasons why we advise him post-operative radiation is that radiation contributes substantially for control of the tumor locally, what we call loco-regional control, as well as it contributes substantially to survival.
With the present evolution in the field of technology, radiation therapy delivery has become far more accurate, it has become far more precise. We are fortunate to have Novalis TX in our Max Healthcare. This machine is capable of delivering a high precision radiotherapy, and in addition, it locks itself to the tumor, so that even when the tumor is moving during breathing, the radiation is delivered only to the tumor with very few side effects.
Before surgery, there was a time when I could hardly speak and I could hardly eat. And my work also obviously suffered because I could not speak to my patients.
But as this video shot by Dr. Chaudhary himself barely 2 weeks after the surgery reveals, Dr. Pandey was soon able to eat and drink and to speak.
How many weeks you are now after your surgery? 2 weeks? 2 weeks.
And now I think God has given me a second life. So that's why I'm living it the maximum I can. And I think that God has given me a second life to do something more than just treat patients.
This desire to do something for the larger good has translated into a greater environmental consciousness, which on the evidence of this video footage borders on keen activism. He spearheads the movement to rescue and transplant trees that are under threat and organizes sit-ins to protest the felling of trees in and around Dehradun. And of course his practice, which had taken a backseat during his illness, is thriving once again.
Hi, come on in, welcome, most welcome.
Perhaps no one exemplifies the patience of courage as much as Parijat Vohra, a feisty girl whose boundless courage, positive attitude, and winsome smile have seen her through the worst that life can sometimes throw one's way. Following the breakdown of her marriage and the loss of the custody of her son, Parijat was going through an emotionally trying phase when one day, while she was praying, her clothes caught fire. She suffered severe burns on her upper body.
The turning point, I would say, was the day when this accident happened, and it was 5th of September. It's one of my favorite days. It's Teachers' Day. It was also the day when my so-called divorce had happened. But never mind that. I was fighting for my kid, for the custody. I still am. As the days passed, I had no one to talk to, and I would go and start complaining to God. Why? I have done nothing in my life to deserve this. So why? Why me? And from the diya, we have a diya stand, actually not a diya stand, because I was standing, and I'd say bowed down a little from my archel, the fire caught up, and I was too I would say numb to react. It's only when I felt the heat unbearable, and I was saying, and immediately my dad, he came, and he literally burnt his own hand. And when I was enough, I was back to my senses. I went to the washroom, opened the tap, sat just below the tap, and the damage had been done. 10 minutes flat, and my life was a different life.
Parijat came to me not only with unsightly burns, scars, but also scars which were causing a lot of functional deformities and disabilities. Her neck movement was restricted, her hand movement and the various shoulder movements were also restricted.
Mostly I see ugliness when I look into someone's eyes. I don't see it with myself. I don't have a mirror. If you look at here, you won't find a mirror. So when you're a burn patient, you're not just a person. You are everything plus your scars.
Like any other young and active person, she wanted to get back her life. And the only way I could give her back that active life was to bring back the normal skin that she had.
I was looking for this treatment. I didn't know what it was, but I knew there is a skin we get, and it is very new. He told me about this Integra, which is a kind of skin.
The only solution that we could think of was Integra.
When Dr. Chaudhary started saying about Integra, I literally had goosebumps.
Integra, it is artificial dermal matrix. Essentially, it is artificial skin which is genetically tissue engineered.
After many discussions and consultations with Parijat and her family about the complexity of the procedure and also the ordeal that she would have to go through in the post-operation period because of immobilization of her neck and arm, the big surgery was planned.
When we use Integra in such a large area, it's important to keep it in place, as the slightest of movement would cause shearing.
And so, Dr. Chaudhary and his team had to use over 900 staples to make sure that Integra stayed in place.
It was easier to put staples in while Parijat was asleep under anesthesia, but removing 900 of these staples one by one in post-operative period was a painful experience for her. She took everything in her stride and was laughing and joking all along.
People talk about miracles. They look forward for miracles. They believe or disbelieve miracles. I live one practically every single day of my life, and sometimes by the hour. So I feel truly blessed, truly blessed. There's this poem very close to my heart, Make Your Faith Take a Leap, a tribute to everyone who has struggled in life. I hope that it gives some inspiration. When somewhere within your heart a tempest rises and the tide of emotions takes you deep, let the calm of your soul nourish you and make your faith take a leap.
Max India Foundation was created to be the expression of the Max India group of companies to benefit a larger cross-section of society beyond just the patients of Max Healthcare. We support 4 NGOs, all on a health platform, as that is our core business. Being in the businesses of social good, being in the business of life, this was almost a natural. So I'm very pleased that in this instance, Max India Foundation has partnered with the SOS Children's Village, and in other instances with the other NGOs that we support, every time and all the time, in some way or the other, improving the wellness, improving the health, and improving the life of young kids to very senior citizens of our society, even beyond the age group of 80, where we have installed calipers and Jaipur foot on patients who have been 80 and 85 years of age. So I'm glad this outreach program is working.
One of the regions where we thought we could make an additional difference was in this field with Dr. Sunil Chaudhary. We decided to hold camps to identify children with cleft lips and cleft palate.
To understand how a cleft lip deformity actually is created, one would have to go to the time when the baby is in the making in the womb. There are 2 elements of the lip which essentially unite together to form a perfect lip. If one of the genetic switches goes faulty, the 2 elements fail to unite, and that's where a cleft lip deformity is created.
When children are born with an anatomical defect, one needs to have empathy towards this to understand that it starts affecting their life per se, their self-esteem, their communication social style, even their academic performance, their relationship building, their self-image. All these things actually take a beating.
We called the children and conducted health check camps. Dr. Chaudhary and his team checked the children, and we spoke to the families, gave them confidence, gave the children confidence that through these surgeries they would definitely lead better lives.
There is such a marked transformation from the before and after that sometimes it's hard to believe that these are real cases.
Every time after the surgery, when the parents catch the first glimpse of the baby with a normal looking lip, it brings tears to their eyes. These are the tears of joy.
A star will shine in the darkest sky, a way will come up if you try. If you believe, the invisible hand will lead you to the place you belong to. There never was a night the light did not shine through. There never was a tear God did not answer to. There never is a sorrow invincible by a smile. All good things do come, it only takes a while.
Amazing team. Every doctor is like, I'm totally their fan.
It's all thanks to Dr. Chaudhary. I'm really grateful to Dr. Chaudhary, Dr. Vedant. Again, never ever, what they did, they were like gods for us.
We must learn to try and live, even if the sorrow is fathoms deep. We must learn to win and give and make our faith take a leap. I think the story does not end, it starts. It starts.